Good evening. How everyone doing? I'm gonna start off. With a prayer. Where everybody stand, please. Heavenly Father, I want to thank you for this day, dear Lord. Dear Lord, I want to thank you for waking us up this morning, watching over us, dear Lord. Dear Lord, I want to thank you for each and every one that's here, dear Lord. Dear Lord, I want you to put in the input that we're going to get today, dear Lord. Dear Lord, I want you to watch over everyone's health, dear Lord. Dear Lord, thank you for our pastor. Thank you for our pastor family, dear Lord. Thank you for everyone that's here, dear Lord. This I pray. Amen.
Amen. Thank you. Hello, family. Good evening. Thank you for coming. Um, I'm not sure if you all were aware that March is Kidney Disease Awareness Month. And the reason the Health and Wellness team and myself, we wanted to present this because this is an issue that if you all don't know me, I'm Tanya Stitt, the Director of Health and Wellness. Something that I work with daily, on a daily basis. As you all know that I am a nurse and I work in a specialty area. And one of the procedures or surgeries that we do is with dialysis patients, patients who have gone into renal failure, where we have to put catheters in them to be hooked up to dialysis machines. We work with accesses in their arms that get hooked up to dialysis machines. So I would say about 60% of the patients that I work with on a daily basis are kidney disease patients. And I will tell you that 90% of those patients are African American and African American men. So this is something that is dear to my heart because I've been dealing with this as a nurse for 29 years now. And the issue seems to be getting worse. Not better, but worse. So to me, that is a lack of education when it comes to us as a people and as a community. So I felt like, this month I wanted to bring this issue to our church, to our community. So someone that I often work with, either by phone or in person, I wanted to bring out to help me with the education of kidney disease. And I would like to present our speaker for tonight, Mr. Charles Army. And I asked him to send me a bio to present to Pastor before, he was received. So I would like to read his bio to you as a beginning of his introduction. Originally from Ghana, West Africa, I, Charles Army, have been living in South Florida since 2008. I have always enjoyed studying the sciences, which prompted my pursuit of a bachelor's degree in biochemistry. After graduating from the University of Ghana, I went on to work in the biomedical science industry for 9 years, where I became more in tune with how intricate the biomedical sciences are and how it translates into the overall care of the patient. As I became familiar with the fundamentals for applying the science to the art and practice of patient care, I was driven to pursue a career in health science. I obtained a physician assistant, that's a PA degree, in 2019 from the University of Dayton, Ohio. Presently, I work with Dr. Farron Abid, who's a nephrologist taking care of patients with renal issues, that's kidney issues. As a physician assistant, I practice medicine to positively affect the lives of the ailing. And this is Mr. Charles Army, who I say I work with if not daily, I would say at least three. Communicate with at least 3 times a week as he make rounds in the hospital, and his specialty is working with patients who have kidney disease and on dialysis. So, without further ado, I would like to introduce you to Mr. Charles Amin.
Good evening, everyone. Thank you for having me tonight. Um, the nerves will come down very soon, but hopefully everybody works with me and we go through this study together. And I hope if there's a message in here for anybody in the crowd that it gets out positively. If I'm speaking too low, please point it out and I'll be able to adjust. Can you hear me better now? Okay, thank you. All right. So, Miss Tanya told me to come talk about kidney disease today. But I figured before we talk about kidney disease, let's try and remember what the kidney even does before we mention what is wrong with it. So I put together a small slide, starting with tell everybody. We all remember our biology from classes growing up, a little bit. Okay, so the kidney is part of a system called the urinary system. And the system comprises of two kidneys. The ureter, those are the tubes that connect the kidney to the bladder. And you have your bladder and obviously goes to the outside. So the main function of the kidneys is producing urine. Why do we produce urine? Is one of the major things is to get rid of or excrete waste from our blood. The heart pumps our blood through the whole body. The blood goes everywhere it needs to go, and any waste that is removed from the body goes to the kidneys. The kidneys filter it into urine that goes to your bladder, and you pee it out. So, one of the major functions of the kidney is producing urine, which to excrete waste. Um, I mentioned elimination there. That goes like from the bladder to the outside. I also mentioned homeostatic regulation. When we say homeostatic regulation, the body as a whole, you need to, for the body to feel okay, your temperature has to be right, your pH has to be right, your fluid levels in the body have to be right. What the kidney does to help with that is, one, if you have too much fluid buildup, we have some patients who have heart disease, they have too much fluid in their body, the kidney pulls out the extra fluid, you pee it out as extra, as urine. That's why when somebody has heart disease, they give them Lasix, they give them furosemide to help them, they call it the water pill, to help pull out the extra water from your body. The way you do it is your kidneys pull it in and then you pee it out. Another thing they do is regulate the pH. Your urine and your blood has to have a specific pH to be optimum in the body. For example, if a female has a lower pH or a higher pH than they should have, there's a chance you could get a UTI. So to regulate your pH, your kidney does that. It checks how much balance you have. Maybe we need more of this solute to increase your pH, or we need more of this to decrease the pH. That's what the kidney does. Another thing it does, which most of us don't really think about, there's an enzyme called erythropoietin that the kidney produces. What that helps with is tell your bone marrow, I don't have enough red blood cells here, activate more, let's increase my hemoglobin levels. So you have somebody who is anemic. If they have kidney disease, it worsens it. If they do not have kidney disease, then it could be maybe they're not eating, they don't have enough iron. A lot of things could be going on. But one of the functions that is not mostly mentioned is the fact that the kidney helps with increasing your hemoglobin levels. Activation of vitamin D. We all need vitamin D in our body. Why? Vitamin D helps us absorb calcium. Calcium goes into our bones to strengthen it. So low vitamin D, low calcium, low calcium, osteoporosis, you have weak bones, and other problems going on. Another thing it does is also produce an enzyme called renin. Renin helps control your blood pressure. One of the ways it does it is by controlling the amount of sodium you have in your blood. We eat too much salt, our sodium levels are going to go up. That's going to increase our blood pressure. Blood pressure causes other problems. We don't want all that. And the last one I put there is carry on gluconeogenesis. Now, the way our body is, you eat, the body breaks it down, produces all the nutrients you need, the glucose, whatever you need to give you energy. Now, if you're in a fasting state, you haven't eaten anything for a long time, what happens is your kidneys help produce the sugars you need for the energy from whatever stores you have, and that's what's called the gluconeogenesis. All right? So basically, that's what the kidney does. Now, what do we call renal failure? That brings us to the disease in the kidney. If somebody has renal failure, then it's probably because the kidney has lost some function. It's not doing what it's supposed to do. And that has been divided into two types of renal failure. We can have an acute one. You go to the hospital, they say you have an acute renal injury or you have acute kidney injury. That is to say, before you came in, your kidney was working fine, something happened, and then you got a kidney disease or your kidney stopped working like they should. Most cases, somebody with an acute renal failure would get recovery. Once you get rid of whatever caused the kidney injury, the kidneys should pick back up and start working. Then we have those who have the chronic kidney disease. Chronic kidney disease means it's been going on for a while, or the kidney is injured at this point. It's going to either stay here or keep getting worse. And typically this is seen in older adults because like any machine, any organ, with use you get wear and tear. So as we all age, the kidney function begins to decrease to a point where it's manageable. But if you have other stressors on the kidneys, it worsens this progression. It worsens the disease. So you have somebody older than 65, you expect the kidney function to decrease a little. But if they have other problems compounding it, then it pushes them further in. If you see a chronic kidney disease in a younger person, is typically because they've already had these stressors that have gone uncontrolled for a long time, leading to kidney injuries. Usually when a young person has kidney injury, most of the time, if not controlled, it pushes them to needing dialysis or kidney transplant or any of that. So that's the gist of renal failure. It could be acute, it could be chronic. Acute, you can recover from. Chronic is progressive, and it's in different stages. Stage 1, which most of us are probably already in, is you still have about 90% function in your kidney. It's just slight changes here and there. Your kidneys is not filtering as much as it should, or they are not producing enough of one enzyme or the other. Stage 2, you're beginning to, it's still mild, but you still have the kidney disease. But this is chronic in this case. You can stay in this point, or if anything goes unchecked, it could get worse. Then you get into the stage 3. You have only 30 to 60% left in the kidney. Then stage 4, that's severe at this point. Then the likelihood of getting close to needing dialysis begins to come in. And at that point, you have about 15 to 30% use in the kidney or filtration rate in the kidney. Then when we get into stage 5, that's when we call kidney failure. Typically, once you get into stage 5, what we need to do now is help the kidneys do what they were supposed to be doing. That's what we mentioned at the beginning. We need to help the kidney filter out all the waste in your blood because it's not doing it properly. So what we do is put you on dialysis. Dialysis is just your blood taken out of your body, filtered like the kidney will filter it, and put it back in. That's when you get to stage 5 or below. And at that point, once you get into the point of needing dialysis, if there have been cases where people start dialysis and they still recover from it and get to maybe a stage 3 or 4 and stay there, or there are people who start dialysis and they never get a recovery. The only way they can get some recovery is to get a renal transplant. We don't want to get a, yes.
When it comes to dialysis, the kidney literally just break. It just what is it actually doing? Is it like totally damaged?
Is the kidney is still there? It's just not doing what. So I have some dialysis patients produce just a trickle of urine all day. So they're not producing the urine. The kidney is still there. It still has blood going in and out. It's not just completely like destroyed, but it's just not working. So typically your blood goes in, filters, goes back out. This time the blood goes in, it's not really filtering, it's just going right back out. So typically people are on dialysis, we put them on a schedule of 3 days a week. And what is happening is between the 2 days the day or two that you did not have dialysis, whatever waste you built up in your body when you come for dialysis, we take it out by filtering it out. So because typically everybody's sitting here while you're not on dialysis, every day you're filtering the waste, peeing it out every day. But somebody on dialysis, they're not producing the urine, so the waste builds up. So when we check their labs, everything is elevated. So you do the treatment, it takes every waste out and put the clean blood out and back. They go home, a day or two, they come back and do it again. Did I answer your question? Yes. Okay. So now we've talked about what kidney failure is. Now let's talk about the causes of kidney failure. So like I mentioned before, acute, something, a stressor happened, messed up your kidney, it could recover or not. Chronic, you already have wear and tear, and the stresses make it worse. Now these are the stresses I'm talking about. High blood pressure. Think of the kidney as a pump, as a filter, with blood going in, coming out, right? Now if the blood is coming in at too much of a force, always pushing through, you're causing injury to the kidney, and this builds up, compounds over time, gets worse. So one of the major causes of kidney failure or pushing people into needing dialysis, high blood pressure, or blood pressure that goes uncontrolled for a long time. So that's why it's prudent. I've had a 40-year-old male come to the hospital because he had a what do you call it, a sinus problem. Like he had a cold. Came to the hospital, they checked his blood pressure. Blood pressure was 200 over something, way too high. But he hadn't been to the hospital for so long because he feels fine. They call the high blood pressure the silent killer because you don't feel it. He went for so long without going to the doctor. He came to the hospital, blood pressure 200. We don't know how long it's been that high. We checked his lab, renal failure. 40-year-old, he's now on dialysis, waiting for a renal transplant. So that's why we recommend that even if you don't do anything, even if you don't check your blood pressure at home, at least see your doctor once a year. Check to see if your blood pressure is good. Because there are some cases, it's probably not anything you're doing to make your blood pressure high. You already have the predisposition to it. It could be from your diet. You're eating a lot more salt than you realize you're eating. You don't know. So it's prudent to have the blood pressure checked from time to time. Another cause of renal failure, yeah.
Before you go too far, I see that you have there for high blood pressure greater than 140 over 90. So me as a nurse, I know that as you get older, your blood pressure increases a little bit higher.
Yes.
But that's a standard
This is an older standard. Because if you're younger, you want to lower. Typically, I would prefer 130 over 80 than anything. That's actually high. Yes, because you want to lower. That's why I put you don't want it this high at all. This is your max. Once you start going above that, you're causing problems. Okay. Another one I didn't put on there is diabetes. Diabetes is also one of the major causes of renal failure because diabetes, as we all know, affects a lot of organs. Having a lot of sugar buildup in there is what happens with diabetic patients is with the kidneys, they start pushing out proteins out of their kidneys, they start losing albumin, and over time, your kidney function begins to worsen with time. And now, if your diabetes goes with your blood sugar goes unchecked for so long, it gets to a point your kidney function gets worse, sometimes even faster than the high blood pressure will do it, and you end up on dialysis. I put on there medications that hurt the kidney. Example are NSAIDs, that's ibuprofen, Aleve, Motrin. Those are medications we call NSAIDs. It's just for pain. You go over the counter, you buy, and take for pain. But they are excreted through the kidney. When I say excreted, it means once it's done what it needs to do, the waste product is released through the kidney or through the urine. So taking a lot of NSAIDs, I'm not saying you don't have to take it. But if you do have kidney disease, we don't recommend you take it at all. If you don't have kidney disease, manage how much of it you take. Because so aspirin, you mean like the baby aspirin? No, they shouldn't. Okay. So the NSAIDs, the more you take it, injury to the kidney because the kidney has to filter it out. So like I said, if you have kidney disease already, I don't recommend you take it. I'll recommend you take a Tylenol. Just make sure you don't have a liver issue. But if you don't have a kidney disease at all, if you're going to take an NSAIDs, just limit it. Don't take too much. Don't keep taking it till you feel okay. It's not safe. As far as, even though high blood pressure can cause kidney disease, too low of a blood pressure can also cause it. Yes. That's why you have to watch. You have to watch your blood pressure. Some people take their blood pressure medications without checking the blood pressure. Sometimes you're dropping your blood pressure too low. Too low, you're not getting enough perfusion. You're not getting enough blood going to the kidney, so you're also causing injury to it. So if you are already on blood pressure medication, make sure you check your blood pressure, even if it's once a day. Check it. Make sure you actually need to take the medicine that day before you take it. Okay? High cholesterol from our diet can lead you to kidney disease. Smoking causes a lot of problems throughout the body, including kidney disease. We've mentioned uncontrolled diabetes. One I don't have up there is that sometimes it's beyond your control. Some adult males get what we call the BPH, the prostate gets enlarged. Now what happens is once you have an enlarged prostate, you're not peeing as much. You're holding the pee in, it backs up into the kidneys, causes some injury. So I recommend that once you're of age to have your prostate checked. Have it done so that you make sure you're not holding back too much urine that is causing problems. Yes.
You skipped over the IV contrast.
Yes.
And I don't think a lot of them know what that is and what test they use that for.
Okay. So when I'm in a hospital, sometimes we get consulted as nephrologists to talk to a patient because they are going to get IV contrast. The reason why they do that is because you need consent from the patient to use contrast on the patient. Contrast is a dye that they put in your blood that helps with imaging. So if, let's say, I want to see a part of your arteries. I want to see clearly to see if your heart arteries are clear enough. You put a dye, you take the picture. So there's a high probability that after using contrast, that it could affect your kidney. You could have a slight injury, which will be acute. Maybe after fluids, it gets better, you move on. Or some patients who already have kidney failure, they get the contrast and it pushes them to needing dialysis or something like that. So it's something we want to be careful with. But having said that, sometimes, even though the contrast could hurt your kidneys, you still have to weigh the benefits and the risks. For instance, you have a cardiac concern. They need to do a contrast to check your heart. Without your heart, no blood is pumping. So, you're forced to do it. But just keep in mind that there's a chance after doing that, something is going to get hit on the kidneys. And there's a chance that will happen. Your kidneys filter it out and no problem at all. Claire?
So if you go to the doctor and they say they want you to go get a CAT scan or MRI with contrast, these are the tests that they order where they inject that dye in the IV to see the pictures, the imaging. The most important thing I tell patients is if they order that, you make sure they check your lab work to see what your kidney function is before you consent to having that dye. Because if you have let's say, stage 3 kidney function, that contrast, that dye, can send you into renal failure. So it's always important that they check your kidney function before you get a CAT scan with dye or MRI or even cardiac cath, like he's saying. Something wrong with your heart, they want to send you and check your heart. They have to use that dye. But they also need to know what level you are in your kidney function.
Yeah. Because yes.
You said something about being hydrated. Was that like before it? Did you say that would help?
Sometimes it helps if a patient comes to us and then we check the renal function and we looked. So typically the cardiologist somebody wants to use a contrast. They consult nephrology, say, is it okay to use a contrast in this patient? So the first question we ask is find out what the kidney function looks like. If we look at the kidney function and we see that you already have some amount of renal failure going on, the next question is, do you need this imaging at all? Because if they can do another imaging without needing to give you the contrast, it's best to go that route. But if you're at a point where it's either this or nothing else, then what we do is we pre-hydrate the patient, give them IV fluid before they do it, and they make sure they use the most minimal amount of contrast as possible, and then after we give more fluids too. Okay? All right. So who does kidney disease affect? It's everybody. However, there's been studies that have shown that it's more prevalent in the black population than it is in the whites. And I think it's basically because of the predispositions, high blood pressure, mostly amongst us, diabetes, mostly amongst black people. So, high cholesterol from our diets. We have a lot of, high cholesterol containing foods and stuff like that. So it is prevalent amongst black people, but I think it's also because of the other things that could lead to renal disease. All right. Treatment. I put a whole bunch of stuff on there, but we don't care about that. So, the best treatment for kidney disease is to treat what caused it. There's no medication you give that will heal your kidneys. If blood pressure is the reason why you're in renal failure, controlling your blood pressure helps it. If it's low blood pressure that's causing it, controlling the blood pressure causes it. If it's dehydration, giving fluids helps it. If it's, what are some of the causes we mentioned? If it is prostate, you're having urine backed up, getting rid of that urine will help with a kidney disease. So the diabetes, controlling your sugar will control it. So there's no specific treatment, but you treat the cause and you treat what happens after you get renal failure. So you have renal failure. Remember, we mentioned one of the works of the kidneys is to help you activate red blood cells. So you have renal failure, you could be anemic. So what you do is we have to treat the anemia because your kidney function is causing it. We have a lot of electrolyte imbalances that happen because your kidneys were regulating your electrolytes to begin with. Now they are not doing it. We have to replace or take out any excess electrolytes if it has to be done. So the best treatment for kidney disease is prevention. One, don't get into renal failure. And two, if you are in renal failure already, treating the cause is the best treatment. So I put a whole bunch, but that's the main treatment. Now, I also mentioned their timely planning for long-term renal replacement. So there have been cases where, so there's a stigma on dialysis. Patients hear dialysis and they're like, I had a family member who died of dialysis. There's a stigma that everybody is afraid to start dialysis if they need to. But we don't want to get a renal failure to begin with. But if you happen to already have the renal failure and you get to the point where you need the dialysis, everything should be explained throughout the whole process. But we get to a point where people refuse. When you refuse dialysis, we cannot force you to do it. Now, what happens with patients who refuse dialysis is, one, since the kidney disease or renal failure is so progressed that your kidneys are not doing what they are supposed to be doing, you start having a lot of stuff build up in the blood, and then kidney disease has been known to lead to heart problems. You have a lot of problems compounding, and not starting the renal treatment or the dialysis early could, decrease mortality. It could also reduce your chances of getting on the list on time, transplant list on time, and stuff. And sometimes there are patients who, when they start dialysis early, they're able to get recovery from, let's say, a renal failure, CKD5, to maybe a CKD4, and stay there with management. So I'm not saying anybody should get to the point of needing dialysis, but if you do, consider it if it's the option they have presented to you. All right, now I talked about prevention as the main treatment for dialysis. How do you prevent it? Renal failure. How do you prevent it? Diet. You don't want to build your cholesterol. You don't want to have high cholesterol. You eat clean. You don't want to build your cholesterol. You don't want high blood pressure. Low salt foods. You don't want to be eating a lot of salts that will increase your blood pressure. So watching your diet, eating fruits and vegetables, taking your supplements. That's one of the things. Exercise. Taking your medication as scheduled. That same thing. It controls anything that could lead you to renal failure. So controlling if you already have high blood pressure, take your medication as you should take it. But make sure you're taking your blood pressure, making sure your blood pressure is not dropping too low or staying high for too long. Take your diabetes medication. Try and get your A1C to go. You don't want your sugar going uncontrolled for so long because it leads to renal failure and other problems. Reducing stress. That's easier said than done. But we can try as much as possible to reduce stress. Not smoking. alcohol. I didn't put alcohol on there. Alcohol is one thing we should try and reduce. And doing all this stuff would, one, slow progression of kidney disease if you already have it, prevent you from getting into kidney disease if you if you don't have it, and it delays the progression to renal failure if you are even in a high stage of kidney disease. Make sense? All right. Yes.
How does your creatinine level, does that affect your kidneys in some way?
So creatinine is the marker we look at to see how your kidneys function. Creatinine is a byproduct of proteins. Like when you eat and stuff like that in the blood, that gets excreted through your urine. So when you have your creatinine levels building up, your kidneys say, hey, this is too much. Normal, you want for a male about 1. For a female, I think 1.1 or something. Don't quote me on that. But the more they build up in the blood, your kidneys identify it, they put it in your urine, you pee it out. Now, if you have kidney failure, the kidneys don't do that, so they start building up in the blood. What you see is for a typical acute kidney failure patient, will probably go 1.5, 2, 2 point something is going up. We do some treatment, bring it back down a little bit. Now, if you have a dialysis patient, it goes as high as 6, 4, 5, 6. It can go as high. So the more it builds up in your blood, then we know your kidneys are not doing what they're supposed to do.
What is the purpose? You had a medication up there,
Calcitriol. Okay, so remember I mentioned how the kidney helps with activation of vitamin D, helps with your bone minerals, like to increase calcium levels. It regulates calcium and phosphorus levels in your blood. So you have patients, when they get into renal failure, these are not regulated. So what we do with that is give medication to help control your calcium and your phosphorus levels. And calcitriol is one of those. Yes.
You know, suppose you're just a person. You don't know your blood pressure's high.
Yes.
I mean, besides decreasing your urination, any other signs that you have?
Kidney disease. There are some signs, but it's not very obvious. There's no obvious sign that you have kidney disease unless you check the labs. But you will see stuff that might be concerning, like you have some swelling, decreasing urination, like you mentioned. Weakness is also a sign because you could be anemic, your potassium levels could be low, stuff like that. So weakness, edema, decreased urination, paresthesias. Sometimes you get like muscle cramping and stuff like that. It could say you have some kidney something going on, but it's not a definitive science.
How many patients do you see? Because I've seen a few where they have recurrent kidney stones.
Yes.
There are some people who are prone to kidney stones, and it causes them to have kidney failure.
Yes. So the way kidney stones will cause renal failure is similar to how the prostate will cause it. Because what happens with the kidney stones is they build up within your kidneys. Sometimes they get lodged in. You see those tubules I showed you that lead to the bladder? They get lodged into it. Your kidneys are still producing urine, so it backs up and builds up in your kidneys. And then you get into some acute injury or renal failure over time. So the more stones you have built up in there, the chance of being a blockage is high, and that will lead into kidney failure. So sometimes the best way to do that is, stones, it could be hereditary. Some people get stones because it's a family thing. Sometimes some people just stay dehydrated for so long that they start having stones build up and stuff like that. So prevention is key in that point too. Unless it's family and then you do have it, you make sure you see a urologist to make sure they get the stone out of the way before it causes any harm.
But make sure they heard dehydrated. Because
Yeah.
a lot of people don't drink enough water.
Yes.
And just because you drink a soda or iced tea, that's
It's a diuretic.
Thirsty when you know, people are thirsty and they go to grab a soda. A soda has caffeine, and caffeine dehydrates you. So you're gonna be on this continuous vicious, I'm thirsty, but it's gonna be doing the opposite of what you think it's doing. You have to drink water.
Yes. Yes. Unless your doctor has told you not to.
Right.
Because we have our heart failure patients or kidney failure patients where we limit how much water you have to drink. So, yes. It depends. So usually when we see our patients that have a renal cyst, most of the time we just monitor them. Unless most of people have just a simple cyst, but if it's beginning to change in size and stuff like that, you have other things going on, then maybe there might be cause for concern. But typically for a renal cyst, it's monitoring to make sure we are not missing anything. Yes.
You said one of the signs is swelling.
Yes.
When should be swelling?
The foot. Yeah. Sometimes if you get swelling in the foot, some people it goes all the way up. Yeah. That's where it typically starts, but it can progress. You can even have facial swelling too. Any other questions?
So I had a question. You mentioned water. You limit the water intake.
Yes.
Why is that?
So there's one thing I always tell my wife at home, that sometimes we take things for granted until I go to see my dialysis patients, and they tell me they are so thirsty, but they cannot drink any water. We have to limit dialysis patients. We have to limit how much water they drink, because there's a limit to how much fluid. So when we do the dialysis treatment, one of the things we help take out is the excess fluid, which your kidney was supposed to be doing in the first place. But there's a limit because of the body size, how much we can take out at once without dropping your blood pressure too low. So to avoid that, we tell the dialysis patient to limit how much fluid they take to about 32 ounces a day. Imagine having to only have 32 ounces a day of fluid. That includes soups, teas, anything that has water in it. Total plus the water you drink in the day is like 32 ounces. Because once they go over, the water has to go somewhere. If you have excess, sometimes it goes into the lungs. They become short of breath. It goes into the feet. You get edema. So to avoid all that, you limit how much you take. Any other questions?
When you're talking about day, not 8 hours, but 24 hours.
Yeah. A day, yeah, 24 hours, yes. Yeah. So it's difficult. It's difficult. I've had a patient tell me again that, yeah, it's easy for you to say because your kidneys are good. It's true. Because while he's pouring water to drink. Yes.
And some people, when you say drink clear water, they'll take like a sip of water now and then. That's not it. You gotta pour a glass of water, drink it. Don't just let it sit there and take a little bit of time, a little bit of time. That's not what you do.
You mean as far as being hydrated?
Yeah, if you don't have kidney. Yeah.
If you don't, just as much as you. So if you don't have kidney disease, as long as you're meeting a fluid goal within the day, I'm not saying chug it a lot, but just make sure you get fluids throughout the day. Okay?
No, I wanted my sister here to give her testimony.
This one. I'll give her this one. I'll give her this one.
Okay. Good evening, everybody. My name is Vivian, and 2 months ago, I had my right kidney removed. And it was all because I went to the doctor and had my regular checkup, and my... Okay. Okay. Oh, okay. 2 months ago, I had my right kidney removed, and it it all started with just going for my annual checkup. My primary told me that I had blood in my urine, not that I could detect it. So right away, she sent me to go and get an ultrasound. The ultrasound revealed a mass on my right kidney. So right away, she sent me to a specialist, and he told me I had to go and get a CT scan with contrast, and it showed that I had a mass on my right kidney. So when the specialist saw it, he told me, "You gonna have to have surgery. Pick your date, January 12th or the 26th." I had a cancerous tumor on my right kidney, and if I hadn't been going to the doctor, I would have never known. I had no symptoms whatsoever, none at all. And by the grace of God, I'm here. I didn't have to have chemo or radiation. The cancer was just contained to the right kidney. So it is so important to go every year and get your checkups.
Thank you. All right, so that brings us back to making sure we're getting at least an annual checkup, because there's a lot of stuff that can go on in our bodies that we can never know. It's not something you can just see. Sometimes you have a lot going on. You look very healthy, and never know it. Yes.
We as black men, what would you recommend? Because a lot of us are reluctant to go annually or just go to the doctor, period. For us to prevent us from falling into the category of kidney disease, kidney failure, dialysis, all of that causes us to our body to fail.
I recommend at least one-time visit, annual visit to your doctor. At least one. Because what happens with even one annual visit, is they do all the labs. They do your vitals. And if they find one thing off, and you can schedule a follow-up visit, And if you need to be on medication, they tell you what you need to be on. If you need to do a lifestyle modification, you know what you need to do for that. For instance, we mentioned blood pressure up there. It's not always treated with medication. Sometimes you just have to make a few changes, and you can prevent having high blood pressure, or you can even control your blood pressure. I've had patients who, after some time of being on diabetic medication, they lost weight, they started eating better, they got off medications. So going to your doctor annually, even at least once, you go, they check, and then point out any parts of your vitals of concern or anything in your lab that is concerning that needs more follow-up. Make sense? Yeah. And if you want to do something yourself at home too, once in a while, check your blood pressure. If you're having sometimes somebody's having a headache, they just want to take a Tylenol, and maybe you're having that headache because your pressure is too high. You don't know. And then all those, so there are some preventative tests that your primary might recommend as you hit certain milestones. I'll recommend we do it. Having your prostate checked, having your colon checked, having your colonoscopy. All these tests that they might recommend during those milestones, have them all done, and then you'll be able to catch stuff ahead of time. Any other questions? Yes.
I've seen, but have you all seen an increase in acute renal failure because of COVID?
We did see some, but some of the things that also cause kidney disease that I probably didn't put on the board there is if you are septic, like really sick, you get septic, it drops your blood. If you are those who get viral infections, for some reason, when the COVID first started, we had a lot of patients coming in with acute renal injury, but we couldn't tell. Sometimes you're able to guess maybe it's because of around this, it's because of this. maybe blood pressure was too high. That's why but in some cases, we couldn't tell why it was going on. The best we could do was manage it symptomatically and make sure it doesn't get any worse. I also had a patient who had a renal infarct because they were throwing clots, and the clots, so remember I told you blood goes into the kidney, goes out. The same way blood goes to the kidney to feed it. They threw a clot, it didn't, so that part of that kidney will not get the blood flow to it, and that's what you call a renal infarct, and that will cause an injury, and then you get a kidney injury. Kidney stops functioning properly because of that. So we saw a rise of it. Some of them we couldn't tell. Some we could pinpoint that it was because it was sick, because of this, or because of that.
I just noticed that we saw an increase during COVID.
Yes.
Fortunately, a lot of those patients' kidneys recovered
Yes.
once the COVID was healed. They
Those,
were healed from the COVID.
those are the best times when you have a patient with kidney injury, you're able to help, and then they come back from it. It's good to hear, but there are those who don't come back from it, and they have to progress to dialysis, and it becomes problems later.
Is there a high rate of kidney transplants?
So it's not, the transplant process is very long. So this year, out of our dialysis patient, we've had about, if I'm not mistaken, 3 or 4 that have gotten transplants, but that's not normal. It's not something you see a lot. Those guys were already on the list for a long time. And for you to even get on the list, you have to have been on dialysis for some time. You have to show them that you've done everything possible to help your kidneys before they even put you on the list. You have to go through a lot of testing to be approved to be on the list. And once you're on the list, sometimes they get called in, they go, the kidney will not take, so they don't have to do it. They send them back home. Sometimes you go, you get a kidney transplant. After some time, it stops working, you're back on dialysis. So it's not always a given that once you get a transplant, the problem is gone. Yes.
I'm noticing a significant increase in dialysis centers in the community. I mean, it's like almost on every, not every block, I mean, every, mile or so, there's another dialysis center, which was not the case even, 10 years ago. So why the significant increase in dialysis centers?
I think one is because of our population. We have a very high adult population in South Florida, and we've had a lot of incidences of people going into renal failure. One, because of non-compliance, people not taking their medication, getting progressively sicker and ending up on dialysis. So unfortunately, it's becoming a business because people are getting sicker. Yeah. It's sad to say, but that's what it is. Yeah. Yes.
Have you heard of lisinopril being bad for African Americans?
Okay, so when I was in school, there is to treat high blood pressure in African Americans, lisinopril is not recommended as first line. Typically, a hydrochlorothiazide or calcium channel blocker is recommended. Lisinopril, however, is not first line for African Americans, definitely. You can give it to African Americans, but it's just not first line. But what they've said is kidney protective for patients who have diabetes and high blood pressure. Speaking of that, though, this is a funny thing. Lisinopril is kidney protective, but if you have kidney failure, it's not good for you. I don't know if that makes sense. So if I have a patient come to me in the hospital and they have a kidney injury, which is an acute, and they're on lisinopril, we take them off it until they get some recovery, and we put it back on if they have to go on it. But however, if somebody already has diabetes and they have high blood pressure, but their kidneys are fine, it's good to give lisinopril because it kind of protects your kidney from getting to the point where they are injured. So it's something to play with. But you are right. It's not first line for African Americans for a blood pressure treatment. I hope that helped a little. I didn't confuse anybody. I'm sorry. So to answer her question, it's not first line for African Americans. You can give it, but it's not first line for blood pressure. When I say it's not first line, means you try something else first. If it doesn't work, you go to it. Make sense? Okay. Any other questions? So typically a hydrochlorothiazide is good. HCTZ. Hydrochlorothiazide. Nifedipine is good. Amlodipine is good. The hydrochlorothiazide I mentioned is good, but also remember it's a diuretic. So it's like a water pill. So you have to weigh that too. So typically we try all those first. And you go slow. When somebody is new to being high blood pressure, to being hypertensive, you put one pill on slowly. If you have to increase, slow. You don't want to do too much at once because you drop the blood pressure too low. Anything else? No other questions? All right. Thank you for helping me through it. All right. Okay.
One more question. Now, if you recovered from acute kidney
Yes.
and it left you at stage 3, that's where you're going to stay at stage 3 if you...
So it depends on how long after the recovery. So recovery can be ongoing. You can have an initial insult and your recovery might be slow, progressively, back to your baseline. When I say your baseline, wherever you were before it jumped up. But if you're already at 3 before you got a acute kidney injury, usually you go back to 3. But if you are higher, or if you are maybe 1 or 2, sometimes you go back to 1, you go back to 2, or you can stay at a 3 depending on how long it's been since your recovery. Okay, so you're there. If it's been 15 years at 3, then you're 3. So in your case, we'll say, I don't know if that's you, but we'll say that's a chronic kidney disease, stage 3. And it's just going to stay there. Did I answer her question? Yeah. Because after 15 years, it's not going to change much. The good thing is it stayed at one place. It didn't get worse. Yeah.
People who have one kidney, my question is, there are people who are born with one kidney. There are some that only have one kidney functioning properly.
Yeah.
They have 2 kidneys, but only one is actually functioning properly. Are they more at risk of going into renal failure?
Nah, not really. So there are people who have born with one. I've had people who have had atrophied kidneys. Now, as long as that one kidney is still working and you don't have the stressors we mentioned in play, that kidney could function for a long time without issue. Granted, with age, there might be wear and tear on it, but not to the point of going into renal failure if you don't have those stressors. Yes.
A lot of people drinking alkaline water. Is that water better, or is the filtered water better, or spring water? And what type of, a certain type of water?
I think water is fine. Yeah. Yeah, I think just water is fine. Any of them is fine. I won't say one is better than the X. yes. I've heard about the alkaline water is supposed to help you, but I cannot attest to it. Yes. Yes. All right. Any other questions? Yes.
You say the body can work with one kidney. Being, taking that everything else works like it should. You wouldn't recommend donating kidney, would you?
Some people need it. I have a friend who donated to the dad, so I won't knock it because the people out there who need it. So, yeah, as long as you have good kidney function and you don't have any comorbidities, they should be fine. Granted, the kidney transplant department will do all that test anyway before they take your kidney. If you have any reason why you would not be able to give your kidney away, don't do it. If they find one thing wrong, they won't take it. No. I've had patients who say, oh, I have a brother who's going to donate, but I have to tell them, make them aware so that they don't get disappointed later. If your family member has one thing wrong with them, they're not going to take it. But if you're fine, you have somebody who needs it, and you don't have any comorbidities, yeah, it's fine to give. All right. So, put a small conclusion together. We can all do it. We all need to eat right, exercise, take our medicine, see your doctor at least once a year. Check your blood pressure if you're on medication. Make sure you need to be taking the blood pressure medication. Check your sugars. Make sure you check your A1C frequently. You want to keep it to go. And we should all be all right. Yeah, check your prostate. That's important too. Yes. Okay. All right. Thank you for having me. Who do I go to? Thank you.
Appreciated good information, but we got to use that information though.
Yes.
Yes, sir. Absolutely.